Hello, my name is Kathleen, and today I will be sharing a presentation on the information-seeking behaviors and needs of healthcare providers. For the purposes of this presentation, I have developed a fictional location of a medical library located at the Mid-Hudson Regional Hospital, of which I am a part of the library staff and am presenting to coworkers and fellow hospital staff. While this hospital library does not actually exist, the structure is based on other physical hospital libraries in the New York area. The Mid-Hudson Regional Hospital Library provides services to all employed healthcare staff and medical students. The collection includes both print and digital materials, including medical textbooks published within the last 10 years. Currently, we have on-site librarians available to assist with any inquiries. Our goal is to continue to provide the best service and attend to the information needs and behaviors of our patrons. Ultimately, this will aid providers with improved patient care experience. The full user group includes all medical staff, but for the current literature search, the primary user group includes healthcare providers with a specific focus on physicians, nurses, and medical students. The information needs and behavior of healthcare providers continues to change as technology and medical care evolve, and often these needs and behaviors depend on several variables, which will be discussed in greater detail. Some general trends can be seen with information needs between these three subcategories of providers. Physicians often report a greater need for immediate information regarding diagnosis. This is seen mostly during office visits and patient encounters, especially initial assessments. Nurses report a greater need for information related to longer-term disease and care management. This suggests that nurses often engage with patients regarding aftercare and for longer periods of time and a greater number of encounters. Lastly, students report a greater need for research-related information outside of clinical care. Despite slightly differing needs, overall, the top information needs were related to diagnosis, treatment, and prescription. Sources to satisfy these needs can include colleagues, patient records, online search platforms, textbooks, and digital sources, including articles, ebooks, and health information networks. Some of the most common barriers to information include limited time and lack of confidence in information search and retrieval. According to a 2020 literature review of 73 articles, physicians spend anywhere between 2 to 32 minutes during patient encounters searching for information. 2 minutes is extremely brief. This is certainly a time constraint. Physicians will also avoid information searching when they do not feel confident in their abilities to effectively search and interpret reliable sources. They often report feeling particularly vulnerable when doing so in front of a patient. Opposite to barriers, we must also consider reported facilitators, which will help us to best structure and create our services. Some facilitators include speed, convenience, dependability of information, and satisfaction with that information. Keep this in mind when discussing possible library services. Today, we will focus primarily on some solutions to this first barrier of limited time. According to Ziff's principle, which is based on innate human behaviors and suggests that humans will behave in a way that expends the least amount of energy or effort. Healthcare providers are no exception to this, and the literature supports that. Healthcare providers need immediate access to trusted and reliable information. Often, Ziff's principle is grouped with the cost-benefit paradigm, which considers the quality of the information being used in addition to the amount of effort used to acquire it. This leaves providers asking themselves, is it worth the additional time and effort to look for further information? Seamless and efficient access to reliable information is key. This can be achieved through integrated EMR systems and the use of tools like e-prescribing, clinical decision support, and the services provided here by the medical library staff. So, what services can we focus on to ensure that our patrons are receiving the most up-to-date, reliable, and accessible information? Proposed services include interlibrary loan and research assistance. This is especially relevant for students who report needing access to databases for classwork, research, and gaining knowledge in a new area of practice. Some of these databases include PubMed, Embase, CINAHL, and the Cochrane Library. We can also design and implement programs that aim to increase physician confidence in accessing and retrieving reliable information. Of course, this also means providing the most current and up-to-date information within those search platforms. These training programs could be offered in person by request or via online. Recording training videos should also be made accessible. We must also continue to survey our patrons and measure their satisfaction with our services. Lastly, we must provide these services virtually, as research has shown that both physicians and students alike do not visit their physical library space often, or at all sometimes. It is through these services that we provide actionable steps that are supported by information behavior research. Ultimately, ongoing research in the field is necessary to continue to provide the most up-to-date, reliable, and accessible information to healthcare providers. Thank you, Mid-Hudson Regional Hospital Library staff, for joining me for this presentation today.